Our nation can be characterized by many great traits: hard work, discipline, grit, dedication, determination, selflessness, bravery, courage, strength, a quest for success. We have a rugged streak of individualism, a desire to get things done by any means necessary, even if it means going it alone. These are admirable American traits and have made us who we are. But they are also why we are where we are on mental health. We Americans find it so difficult to ask for help, to show people we need support, to recognize that maybe we should not always go it alone. Our nation is facing a mental health crisis, one which the unprecedented stress and uncertainty of the pandemic has forced into plain view, demanding to be addressed, to be seen, to be helped. And that perhaps may be the silver lining of the pandemic, that we have finally woken up and taken notice of this epidemic in our country. Just think about it. Healthcare providers were on the front lines of treating COVID-19 through waves and waves of patients, selflessly putting the needs of everyone else before themselves. In the early waves, when COVID-19 was still new, they were the only ones present to hold the hands of countless people as they passed from this world. Teachers, historically underpaid and overworked, putting together lesson plans to keep our children learning while under the pressure of, what if my school is next? How will I protect my kids? As they see that yet another school is the recipient of thoughts and prayers. No occupation is spared. Law enforcement, firefighters, dentists, veterinarians, farmers. Young people just beginning their lives, thrown for a loop by the pandemic, milestones they and their families had looked forward to, delayed or canceled. Not being able to see friends and family members in person, the anxiety of entering a world changed almost overnight, trying to find a new normal. Parents who served triple duty, caretaker, teacher, breadwinner, all while trying to keep their families safe and healthy. We have all experienced grief and loss in one way or another over the last 3 years. Some of us lost family and friends, some lost businesses or their health, and some of us experienced extreme isolation, anxiety, and stress. But we all experienced something. Our strength as Americans isn't just rooted in our individual discipline, selflessness, bravery, or courage, but in our collective ability to take care of one another. That's why I am so passionate about mental health care, making it more accessible, affordable, and available. During last year's appropriations bill, I successfully fought for an increase of $530 million for the Substance Abuse and Mental Health Services Administration, our most important federal agency for supporting mental health and combating the addiction crisis. For our healthcare providers who have for so long taken care of us with so little support for their own care, I introduced the Dr. Lorna Breen Healthcare Provider Protection Act, a bill that provides funding to reduce and prevent suicide, burnout, and mental and behavioral health conditions among healthcare professionals. And I'm very proud to say that it passed through the Senate and has been signed into law by President Biden. The bill is named for Dr. Lorna Breen, an emergency room doctor who worked on the front lines of the pandemic and died by suicide in the spring of 2020. I'm so proud to say that this bill was signed by President Biden this past spring. And for students on college campuses, I have introduced and passed through the House the Enhancing Mental Health and Suicide Prevention Through Campus Planning Act, focusing on promoting positive mental health among college students and encouraging college leaders to engage in comprehensive planning efforts to prevent suicide on college campuses. I'm now focused on getting that through the Senate and signed into law. During this time of extreme stress for our young people, our colleges and universities need resources to reach out to students and to better support their mental health. Our young children have unfortunately not been spared from the mental health crisis. Suicide rates in young children have been climbing, and the leading method has become by hanging with information found online. There is no reason for young children to be able to find directions on how to tie a noose on YouTube. And I've been working to hold YouTube accountable and to bring down those videos. Our children deserve to grow up in a world that encourages them to be both strong and determined and able to ask for help and lean on their support systems. We all deserve that. And finally, we must make sure that our mental health professionals are respected, that people are encouraged to go into that profession, and that that profession is fairly compensated. We have a shortage of mental health professionals that is hurting our country, hurting our communities. We as individuals and together as communities are so much stronger when we have support systems in place to reinforce our strength, to help us bounce back, and to be resilient. We can do this, but we have to work together. We have to admit our vulnerabilities, and we have to put all politics aside as we work on this critical issue. And with that, I yield back.